Many parents have questions about their children's safety when they return to school. If you have questions, we have an expert for you for the remainder of our program this morning. Dr. Dina Kulik is with us, a pediatric emergency medical physician, the founder and director of Kid Crew Pediatrics, and she's in Toronto. Dr. Kulik, a pleasure to welcome you to our program this morning. Good morning.
Good morning. Thank you.
We have a number of conversations to come with you, but let's focus this one on this notion of school reopening because, yes, going back to school, elementary school, and to daycare as of May the 11th in Quebec. What do parents need to consider in deciding whether they send their kids back?
I think it's hard to predict what's happening in mid-May, to be honest. You know, every day this is such a changing, evolving pandemic, really. And will we have so many fewer cases by May 11th? I really hope so. I do have concerns, you know, being a mom of 4 little kids, that if we send them back too soon, we're going to see a resurgence of more cases and a higher mortality rate. So I have my reservations. But, you know, if your area, if your school district has few cases and has had few deaths, I think you could be relatively confident to send them back in this stepwise, safe fashion, as long as people are maintaining as much physical distancing as possible in a school setting when you're talking about children. It's a challenging one for sure.
They're certainly talking about in BC, as they consider this, reducing class sizes, trying to have some sort of framework within the classroom to allow for that physical distancing. But you're right. I mean, they're still working on how to implement that in BC. At the time in Quebec, the Premier last week, he was sort of musing about trying to get a significant amount of the population in terms of Quebec's children infected and develop immunity, this whole notion of herd immunity. But we know that's a risky strategy. And then he's sort of not backtracked from this, but he certainly has said his goal is not to promote a herd immunity. That might be something that might backfire. Would that be a concern for you?
Because it's so new, we're not really sure. We know that herd immunity works for many other illnesses, but it's not a perfect thing. So if you think about the 80s and 90s, before we were giving the chickenpox vaccine to children, we had somewhat of a herd immunity. I didn't get the vaccine. I had chickenpox and I was well, and my siblings were well, and many other people were as well. But there is still, you know, a death rate of chickenpox and an illness rate of 1 to 3%. When we had the herd immunity before the vaccines, some people still get very sick with chickenpox. And that's a thought here too. Most people do very well with COVID. They have no symptoms or very mild symptoms. However, some people do get very sick and some people die. And it's not just the elderly or people with health concerns. There are lots of people in their 20s, 30s, and young children too that have succumbed to COVID. So the herd immunity thing works on a big population basis. Yes, most people, if they get sick, won't get that sick or may even have no symptoms at all. But some people get very, very sick. And we don't know who that's going to be necessarily. It's not just the elderly.
I want to talk in some of the things that you just raised in terms of children and COVID and what we know so far and the ever-evolving science of this disease. But a couple of questions from viewers, Dr. Kulik, specifically relating to going back to school. We had a question from a mom in Quebec who has a 6-year-old son with asthma. And again, Premier Legault has stressed parents can keep their kids at home even when schools reopen. She was wondering whether, given her son with asthma, should perhaps then wait until she figures out if things are safer. What do you think?
So we do know people that have underlying health concerns like respiratory issues, such as asthma, have a propensity to get more sick with certain illnesses. Most viral infections, actually, whether it's pneumonia or influenza or COVID, they have the potential to get more sick. That being said, in children, this hasn't really panned out to be the case. Even children that have had transplants or children with chemotherapy, medications being needed, even these children seem to be doing okay, whether they're not getting it or at least they're not testing positive with it. So though it theoretically increases the risk of having severe COVID infection, it hasn't really been shown in the world that these relatively minor illnesses really increase the risk of significant infection or mortality with COVID in children.
Okay. And Marie's writes with a question. She has a 2-year-old, Dr. Kulik, and also a new baby. She gave birth just a week ago. Watching us with a question for you. All the best with the new baby, Marie's. But she wondered how safe it is to send her 2-year-old to daycare, given the new one at home, someone with very little immunity. What are your thoughts there?
So COVID is acting differently than most other typical illnesses, such as influenza. it hasn't been really making children very sick, and newborns in particular, even newborns born to mothers who have confirmed COVID infection, whether in utero or postnatally, these babies seem to be doing very, very well. I'm not really concerned about the typical young child or baby getting COVID and becoming unwell. I'm much more concerned about their parents and our parents' parents, this generation. Again, that being said, not everyone who gets very sick with COVID is an older person or a sickly person. Some people are young and healthy, but by and large, the people that have an increased risk of death and mortality with this are older people. I'm not really concerned about newborns.
Some great viewer questions coming up for you, Dr. Kulik, and I'll get to them in just a second. But I was wondering if we might sort of talk about generally what we know, what the latest science is on the risks to children of COVID-19, but tie it in, if you would, to what we're hearing about in the news today. And this is British researchers notably warning of a small but growing number of children who are becoming ill with a rare syndrome. It's a combination, overlapping features of toxic shock syndrome and Kawasaki disease, which I know you're going to want to explain. But they think that all could be linked to the coronavirus. And I know you've done some work on this. Can you explain this latest concern?
So with this virus being novel, the novel coronavirus, we're learning new things every single day. It's pretty shocking. It's very interesting to see because most illnesses are, old, influenza, et cetera. So what we are seeing more and more now is that some children and some older people as well are presenting with higher levels of inflammation. And there's some thought that this illness, COVID, is what we call an endotheliitis, or inflammation of the endothelial lining. And this is the lining of our vessels. So for some people, they're presenting with different kind of symptoms like rashes on the feet, which is being termed COVID toes, where there's like purple or brown or red lesions on the underside of the foot or the top of the foot, in some people on the fingers, and it's sometimes itchy, sometimes painful, and that looks like certain other viral rashes that children will get as well. Some kids are getting fever, prolonged fever, which is akin to an illness that we call Kawasaki disease, which also is a systemic inflammatory condition in children where they get fever, they get certain rashes, and other features like coronary aneurysms in the heart. And we're seeing that there's also a rise in older people having strokes and having heart attacks, even people in their 30s and their 40s that are otherwise well. Again, thinking that this is some kind of chronic inflammatory state that's triggering the vessels in the body. Very different than typical inflammatory responses that cause pneumonia, like influenza. So it's all just very different and novel, a different kind of illness.
Really, the understanding of how this disease works, what it affects, is really changing all the time. But is it fair to say, as we've heard from healthcare professionals and doctors like yourself, that the risk to children of becoming severely ill with coronavirus, it remains low? Is that still a fair assessment? For sure.
So very few kids have even tested positive in the first place. At the hospital where I work, we've tested thousands of children, and less than 10 have actually been positive, and most of them have done exceedingly well. What's interesting is that even parents that have confirmed COVID, even children that have symptoms of COVID, many of these kids are actually swabbing negative. And we know the test is not a perfect test. 30 or more % of people that get the test will have a false negative. We've seen that in New York in the study that was out last week that showed a lot of people have antibodies and yet didn't necessarily have symptoms of COVID at all, or even swab positive in the nasal swab test. So again, learning more as we go, but probably a lot more people have had COVID, even if they're asymptomatic, which is great in a way because it shows that the mortality rate is actually quite a bit lower than we thought. But it means that we could be asymptomatic carriers passing it on to other people who might actually get very sick with COVID. And that's a scary thing, which is why we have to maintain our distance.
Yes. And that's, of course, the whole thing behind masks and the changing policy and changing guidance on wearing masks. Viewer question picks up on that very point because we're talking about in some part of our discussion, children returning to school in Quebec. And David writes, as children are a vector for spreading COVID-19, should students have to wear masks in class?
It's a great question. I think that if you're out and about, you should be wearing a mask, not so much to protect you yourself, but to protect others. So when you're wearing a mask, if it's properly fit and you're not touching it and moving it, that's another piece with kids, right? Because we know that COVID lives on surfaces. And as I've been saying for weeks, I want people to assume that COVID is in everybody. Every single person has COVID and every surface has COVID. So if you touch a surface that another person's touched that has COVID, you now have the COVID droplets there. If you then touch your eyes or your mouth or your nose, you're more likely to get COVID. A child is more likely to be, fidgeting with a mask on their face. So though it might protect someone from someone else coughing or sneezing or even talking and spreading those droplets, even in an asymptomatic person, it will block that. But if you're the kind of person that's touching your face often, like often children will, then that would actually increase the risk of COVID. So it's hard to say whether all children should be wearing masks. If you're the kind of kid that can keep your hands away, I think it's a great idea. But the biggest thing is washing hands very well, diligently, multiple times per day for 20 to 30 seconds with soapy water, and to model that behavior for your children, to show them what that looks like, and to keep that physical distance.
Excellent. Thank you for that. A question from Ricky. Ricky's a school bus driver in Quebec, and he just let us know, Dr. Kulik, that when the schools reopen, he anticipates returning to that job, traveling 250 kilometers a day with as many as 44 kids on the bus at any given time, up to 2 hours morning and afternoon, and kids on his bus ages 4 to 12. Now, I would imagine there's some policies coming in place, but for now, he's wondering what he should do personally to keep them safe on that bus.
This scares me. That's a close environment. Even once you're just entering the bus, there's no way for him to maintain that 2 meters of distance. Even if people are walking by and going and taking seats, I'm not sure how you could physically maintain a distance like that. It's going to be a challenge, but he should be in perfect health. All the children should be in perfect health. Though again, a lot of people have asymptomatic COVID. I would suggest that everyone be wearing masks. They're not touching. And there's very good hand hygiene, maybe using hand sanitizer on the way in, hand sanitizer on the way out, of course, washing hands when they can as well. But that is a close confines. I do have pretty significant concerns about people returning to school and work in a mere 2 weeks when, Quebec has battled a lot of this in Canada, right? Their rates of illness are quite high.
Yes.
Yeah, and mortality rate is not nearly zero. It does make me worried. I think we will have another outbreak, unfortunately, there.
You were mentioning the whole point about parents in homes with kids, if the parents themselves develop COVID. And we had a question from a viewer, doesn't want to share a name, but that's okay. Single parent of a teenager and a 20-year-old. But this is broader application, and the parent has chronic illness. So he's concerned about contracting COVID because it could be serious. So the question specifically is how do I talk with my kids about this reality? But let's address that. But also, I know you've been thinking about how to actually plan for the reality, the potential of having one or two parents in a household with children and the parents with COVID.
Yeah, so there's lots to unpack here. If you have older children and you have chronic health concern, I would try to maintain my distance as much as you can. Your children, theoretically, in their 20s and teenagers can cook their own food and, bathe themselves and those kind of things. So if you have chronic health concerns and your kids or anyone else you're living with is out and about in the world, I would absolutely maintain my distance. Because again, your children could have asymptomatic COVID and bring it home to you, and they may not get very sick, but you may get very sick. And that is a very scary thing for me. So if you have family members, whether they're children or other adults in your home, that are moving out around in the world at this current moment, I would absolutely maintain my distance. Again, very diligent hand hygiene and separating yourself as much as you can, using a separate washroom if you can. And this would be true if you have diagnosed infection as well. You want to maintain that distance, use different spaces if you can do that, wipe surfaces very well, very often with products that will kill COVID, and really staying away from those people, wearing a mask when you can, good hand hygiene. It's a tough one for sure, because so many people are asymptomatic and have no idea that they're sick.
You mentioned the products, and that's our final question for this installment, and that is many of those products which parents are using in the home to make things clean and safe and hygienic are, in fact, we're understanding from reports leading to accidental poisonings. Those are on the rise in children. So what do parents need to keep in mind in terms of the safety of those very products, Dr. Kulik?
Yeah, so what we're using to clean surfaces are things like bleach and alcohol and peroxide. And because we're being so diligent in cleaning these surfaces, many of us are leaving these products out on the counter, whereas before we would be, putting them away. I really encourage you to put them away, lock them away. They should be high up, unreachable, behind a locked area. And yes, it's a pain to bring them down and, spray and clean and put them back again, but this is the safest thing. Many people are mixing products. So if they're making their own bleach solution, for example, you might be taking this clear liquid and mixing with water and putting it in a spray bottle. They may not have a label on it. It may look like water. What's to stop your child from being like, oh, I'm thirsty, and then drinking that? These things could be very dangerous. They can cause actual death and really significant injury. So everything should be locked away, not accessible to children. They should be well labeled so that every adult in your house who can read, or older children that can read, can see what it is. And you should not be mixing and matching things as well. There's lots of recipes on the internet of take this and mix this, and that is dangerous. If you're not a chemist, don't be mixing things in your home. Instead, use the things we know work well. 70% alcohol, bleach solution, 3% hydrogen peroxide, or validated commercially available products that we know can clean surfaces, but keep them out of the reach of your children.
And we're getting a lot of questions, Dr. Kulik, from teachers and educators and people in the daycare sector in light of Quebec's strategy to move ahead and reopen elementary and daycares as of May the 11th. Teachers not reassured. That message came through in Allison's report. And here's our first question from somebody who would like to remain anonymous, Dr. Kulik, but is a kindergarten teacher, who writes to me and to us, even with reduced class size, physical distancing will be extremely difficult for students to maintain. And the question is two-part. Can children be carriers of COVID-19? And if this teacher goes back to work, will he or she need to self-isolate from elderly parents indefinitely until there's a vaccine?
Excellent questions. As I mentioned previous, I am quite worried about us jumping back. And as the mom was mentioning in the clip before, we have done this for almost 4 months. And if we go back too soon and the rates start to rise, we will have undone all of the social distancing, all of the difficulty we've all faced. And I do see and feel that parents are struggling with this and children are struggling with this. Mental health issues are going up, and that's dramatic and devastating. However, we've done all this work to get to where we are, and if we go back too soon and start interacting too soon, we may see a rise of cases again, having to necessitate doing this again. If someone is exposed to other people outside their home, they absolutely need to stay away from people that are at risk, including their own parents or grandparents or anyone that has significant health concerns. And children can absolutely be carriers. Many children don't have any symptoms of COVID. They could still pass it on to you. They could pass it on to teachers, caregivers, grandparents, etc. So yes, if you're interacting with others, you absolutely need to maintain your distance from other people that are at risk, and really everyone, if you can, outside of your home. And children can absolutely pass the illness to you and show no symptoms themselves at all.
Alex has a question that's similar, and it speaks exactly to your answer, but given that kids will almost certainly bring coronavirus home with them, and as you've said, they can be carriers, isn't the policy in Quebec short-sighted?
I'm worried about it, yes.
You said concerns.
Yes.
He's obviously honing right in on the very issues that are raising concern for you. Marie is looking for some specific guidance, because what precautions can early childhood educators take with children from up to 5 years old, 0 to 5, when they cough without covering, when they're always touching their mouths and then touching everything else? Social distancing is impossible. What should those educators be doing in the classroom situation?
Exactly as this person says, right? Kids are always touching things and themselves and each other and their faces. Kids touch their eyes and they rub their noses and they suck their thumbs and they put every toy they can see in their mouths. And you can't say, don't hug your friend, don't share that toy. That's exactly what children do. I don't know how we're going to prevent children from getting the illness from each other. Keeping it out of these other people, like the caregivers and daycare providers. Again, great hand hygiene, washing hands multiple times per day with soapy water for 20 to 30 seconds, making sure the nails are clean in between the fingers, in between the thumbs, all surfaces of the hands, using hand sanitizer when soap and water is not available, demonstrating, role modeling, not touching the face and how to keep your distance, wearing masks perhaps as the daycare providers, but a lot of kids are going to be pulling at those masks and playing with daycare providers. This is a challenging one for sure. I'm not sure how we're going to prevent spread in daycare centers with young children.
Bobby in Ontario is writing about her daughter, who's now 7, born prematurely, and doctors had warned her parents, Bobby, about her immune system, how it would always be vulnerable. She has asthma. So how concerned should Bobby be about COVID-19 now, but also with a view to when school does reopen in Ontario?
Unless she really has chronic health concerns, significant asthma, bringing her to the hospital, getting admissions, things like that, I'm not concerned that she's at particularly higher risk of COVID. As we spoke about earlier, most children are doing beautifully well with infection. Many of these children we don't even know have COVID in the first place, but kids, even with chronic health concerns, even kids that are on chemotherapy, kids with transplants, even these kids seem to be either not getting it or getting very mild COVID or asymptomatic COVID.
Dan is writing about an 18-month-old toddler who's spending all of her time with just us, as in just us parents. So Dan writes how they try to video conference with cousins and grandparents, but he's concerned about the impact on his toddler's socialization. Is there any concern about long-term impacts, Dr. Kulik, of limited social interactions for young children at this point?
I mean, certainly this is a very hard age group to be at home. These kids that are 15 months or so to 2 or 3 years, the goal for them is to make them social and interactive and increase their language development. And we haven't had a time like this in recent, times in our generation. So we don't really know what the long-term impact will be. We know that certain things would be helpful. So obviously interacting with you as parents, reading, singing, getting activity. A lot of kids are spending a lot of time on screens, on devices, watching TV right now. And I caution you to follow the similar guidelines as before, which is that kids less than 2 should get 0 minutes of screen time per day. Other than that, talking virtually to family members. So I would minimize screens, as difficult as that is when many parents are working from home. And as much as you can, interact with your child. I think these kids will do just fine. Many kids around the world are at home with grandparents providing care, for example, and they don't necessarily have tons of interaction with other children. So it'll be a few months, hopefully, and we'll get back to it,
yes.
And your children will probably do just fine.
But again, Dale speaking to this point, or to a similar point, in that it's such a change of routine. There is no social mechanism around, and kids do pick up on parents' stresses and anxieties as well. So Dale is wondering, with this affecting everyone's mental health in some way or another, what about children across the country? What would you suggest parents watch for in terms of any warning signs, anything dangerous in their children's behavior that might signal something in mental health is not quite right?
For sure. With all this isolation and fears emotionally, financially, culturally, a lot of people are feeling it very difficult being at home and isolated. We know that there's a rise of mental health concerns around adults and for children. If your child or you are more isolated, finding less pleasure in things that you used to find pleasurable, eating less or eating a lot more, sleeping less or sleeping a lot more, decreased memory, decreased concentration. Certainly, if your child is telling you that they are feeling helpless or hopeless or feeling like it's not worth living, or they specifically say there's some kind of plan to hurt themselves or kill themselves, those things, those safety concerns, you need to go to the emergency room and seek emergency care. For everything else, just, the moodiness and the less appetite and those kind of, slowly building symptoms, I want you to touch base with your practitioner, whether that is accessible to you. Some people don't have accessible healthcare right now. There are lots of places in the country that do have accessible care for you, even virtually. Just to make a phone call, Kid Crew, as an example, where I work, we are available to any kid in Ontario. If you have any concerns about developmental concerns, behavioral, emotional, and physical, you can call us and we can chat with a pediatrician. But certainly, if you have safety concerns for yourself or your child, please go to the emergency room.
So important to know those resource networks are still in place, even though so much is shut down. There are places to turn during the COVID-19 pandemic. Final question for you. Such excellent conversations, Dr. Kulik. We've been doing a lot of reporting of late of doctors expressing their concern, and I suspect you will as well. People who are opting not to get serious medical conditions looked at, or in children's case, maybe delaying going to see the pediatrician, maybe delaying getting their regular vaccinations because they're concerned of the COVID-19 that is out there. What are the dangers of that, and what would you advise?
Yeah, so we have seen that for sure across the board, across Canada, with kids seeking care, their parents taking them in when they're already very sick, much more sick than they should have presented with, or injuries that have gone a few days and haven't been cared for. I want to caution you that kids, by and large, are doing incredibly well, not even necessarily getting COVID or having very asymptomatic COVID. So our children's hospitals across Canada are mostly empty. The emergency rooms are not filled up, and we are not too busy to care for you. If your child is unwell, touch base with your practitioner if you can. Otherwise, reach out virtually to another practice that can see you. And if your child is unwell, if you have concerns about them, whether it's an injury or difficulty breathing or fever that's persistent or dehydration, they're not drinking, they're not as interactive as usual, these things need to be seen in the emergency room if you're concerned. Short of that, of course, touch base with your provider. But if your child is unwell, please don't delay care. Sick kids hospitals seem to be having way fewer cases of COVID than adult hospitals. We are equipped to see you. We can protect you and your child and make sure that things don't go undiagnosed so that we can still prevent, significant illness in your child for other reasons outside of COVID as well.
Such important counsel on which to end this morning. Thank you, Dr. Kulik. It's a pleasure to have you on our program for the first time. I hope it's not the last.
Thank you.
Really appreciate it. Dr. Dina Kulik from Toronto, and thank you, as always, for your excellent